Good morning. It's a privilege to be part of the Wellness Wave ACP Southern California Region 3 chapter. I wanted to acknowledge that this is Black History Month, so happy Black History Month to everyone. I'm Lindia Willies-Jacobo, and I serve as the Senior Associate Dean for Admissions and Equity, Inclusion and Diversity, and Professor of Clinical Science at Kaiser Permanente Bernard J. Tyson School of Medicine. I've been a practicing pediatrician for the last 26 years and spent the overwhelming majority of my career at UC San Diego School of Medicine. I was a medical student at UCSD 1988 through 1992 and did my pediatrics residency and chief residency there, and was a faculty member in 1996 through 2018. I also had the distinct privilege of serving as the Assistant Dean for Diversity and Community Partnerships and Director of the Program in Medical Education Health Equity, where I worked with the most amazing students and colleagues. As I've reflected on my remarks for today, it occurred to me that although I've always tried to be intentional about my own well-being, I found myself thinking about this topic a lot more over the last 2 years as we've been amid a global pandemic, which has also served to bring issues of health inequities into sharp relief. Many have had significant feelings of isolation, and for those in the medical profession on the front lines, we know that anxiety, depression, and burnout are all on the rise. I would be remiss if I didn't mention that folks from BIPOC communities, also known as Black, Indigenous, and People of Color communities, are disproportionately affected. In addition to higher case rates and deaths from COVID-19, we've also witnessed the added burden of systemic racism and anti-Asian violence in the past 2 years. The data shows that acknowledgement of mental health issues in many of our communities can often be met with stigma, and even when folks attempt to seek mental health assistance, there are access issues and issues of bias in diagnosis and treatment. This can all be very difficult to reconcile. What then are some of the ways we can work on our mental health and attempt to mitigate burnout? In the words of Audre Lorde, self-care is not self-indulgence. Instead, it's self-preservation. A brisk walk in between work can do wonders. There's really good evidence that even a 10-minute walk will boost endorphins. We also should ensure that we're remaining connected to friends, loved ones, mentors, even if it's by way of a quick phone call or a check-in by Zoom. It's important to develop a growth mindset versus a fixed mindset, where you begin to see challenges more as opportunities. Also, give yourself grace and permission to feel all that you're feeling. A psychiatrist friend of mine often reminds me that you should never, ever struggle alone. So if something doesn't feel quite right, it's really, really important to talk to someone. I also wanted to mention that well-being is not a one-size-fits-all. It looks different for each person and should always be considered in the appropriate cultural context. Some of my own well-being practices are as follows. I enter each day with intention, and this means that I spend a few minutes each morning over a cup of coffee thinking about what I would like to accomplish for the day. I write it down, but I also give myself permission and grace if I don't succeed in getting everything done. And the main reason that I put it in writing is really to keep myself accountable. The second thing that I think about in terms of well-being, or another well-being practice of mine, is I keep a daily gratitude journal where I write 2 to 3 things per day that I'm grateful for. My third practice is I call my mother on an almost daily basis. I feel really fortunate to have my 85-year-old mother around, and I benefit tremendously from her wisdom. My fourth practice is I work out 4 days a week, which includes some cardio as well as weights. And my final well-being practice is perhaps one of the most important ones. I love spending time with my husband, my young adult children, and pugs, and that brings me not only tremendous joy, but it keeps me grounded. During these times of uncertainty, I do hope that you will spend the time being intentional about your own well-being. In closing, I would like to share one of my absolute favorite quotes from Maya Angelou. She says that my mission in life is not merely to survive, but to thrive, and to do so with some passion, some compassion, some humor, and some style. Many thanks again for the opportunity to speak briefly with you. Wishing you all health and wellness.